could give you a score that increases the likelihood that the nodule that you have is actually cancer. There are some nodules that are just too small for us to tell for sure whether or not they represent anything bad. And so those nodules, we don't necessarily move forward to a biopsy. Why don't you biopsy a kind of suspicious nodule? That's because thyroid cancer is so common and it really doesn't usually cause problems when it's very small. And I know that's really weird to hear, especially from somebody who is a thyroid surgeon. And so I spend my whole life taking out thyroid cancer. But not all thyroid cancers need to have surgery. And so if you have a very small thyroid cancer, you sometimes can just watch it and pay attention to it over time instead of moving straight into surgery. And that's why we don't always move forward with a biopsy. So do your ultrasound based on the size, based on all the rest of that, you'll know whether or not you need to have a biopsy. And based on that biopsy and the size of your nodule and whether or not there are lymph nodes, you will know whether or not you need to have surgery. Now, how do you treat thyroid nodules? So if you have a thyroid nodule, the old-fashioned way to treat it was just to move straight to surgery. And that's what most people will do around the world, is if you have a thyroid nodule and it's either suspicious or it's big or it's growing or it's causing problems, you would take it out. Let's pause for a second and talk about each one of those. If you have a big thyroid nodule and it's bothering you, that's probably a reason to do something about it. Again, the old-fashioned way was just to do surgery. The newer ways to treat large benign thyroid nodules that are causing symptoms include things like radiofrequency ablation, microwave ablation. In order to be offered any of those therapies, you need to be seeing a surgeon who does them, who does some of the normal or some of the newer stuff that we have to treat these different nodules. So as you're talking to your surgeon, as you're trying to find out who you want to see, make sure you talk to somebody who does all of the different options instead of just the old school, take it out, because that's all most people will offer. Okay, continuing on just a little bit as we go forward. If you've got a thyroid nodule that is cancer, same thing. Most surgeons will just move straight to surgery. There are some patients who are eligible either for what's called active surveillance, where we don't do anything with it except for keep doing ultrasounds. And there are other patients who are candidates to have it treated with radiofrequency ablation, which is just heat, which can kill small cancers. Not everybody is eligible for it. Your cancer has to be small and it has to be in the right location. But if it is, then you can treat it and it can actually be super helpful for you. So again, you need to talk to a doctor who has that as an option, and not all doctors know that it's an option. And so just make sure you're talking to somebody who's up to date on all of the latest things as you start considering who your surgeon should be to treat your thyroid cancer. There's also some people who have nodules that are growing, and this probably applies to most of the people that are listening to this, that they have a small thyroid nodule, they're not really worried about it, nobody wants to do a biopsy on it, it's not really problematic, but maybe it's growing. And that can be a reason for treatment. And the reason that it can be a reason for treatment is that when your nodule is smaller, you have more treatment options than when it gets bigger. The bigger your nodule gets, the harder it is for you to actually do anything about it, except for just good old-fashioned surgery. And also the treatments are also even safer and they have better outcomes. And so for all of those reasons, if you're thinking about what should I do with my thyroid nodule, I can tell that it's growing, it's not really causing problems yet, that might be a reason to consider doing something before it necessarily gets super big. Okay, so we talked about different nodules, we talked about what to do with them. Now let's dig into just a little bit about what the treatments are and how you would go about finding somebody to treat them, etc. So if you have a cancer, do you need to do surgery? Thyroid cancer is super common. Sorry guys. So thyroid cancer is super common. 15% of cadaveric specimens, in other words, if you find 15 people or 100 people that died in a car accident and then you do a biopsy of their thyroid to look at what they have going on inside of their thyroid, you're gonna find that about 15 of them actually had thyroid cancer when they died from their car accident or from whatever cause it is. And so that's one really interesting thing, is just to realize that thyroid cancer is super common. And most people don't die from thyroid cancer, they might die with thyroid cancer. And so as you're talking to your doctor about whether or not you should do something for your thyroid nodule and your thyroid cancer, that's one of the questions that you need to find out is, will the treatment make my quality of life worse or will it make my quality of life better? Some thyroid cancers, it is worth making your quality of life a little bit worse because we know that the cancer is really bad. And we know that if we don't actually fix your cancer, your quality of life is eventually going to be really bad, or it's going to shorten your life. But for most people, we need to make sure that your quality of life is just as good as it was before you had surgery. And in order to do that, there's different things that we talk about. And it's all about how do we prevent complications from surgery, and also how do we prevent you from having a big impact. One of the easiest things that we can do is we can set it up to a point where you don't have your entire thyroid removed. Most patients who have thyroid cancer don't actually have to take out their entire thyroid. They only have to remove a part of it, usually half. But that's the biggest thing that you can do to make your surgery safer. And also the really nice thing is that if you have that treatment, then you oftentimes don't need to take the hormone, but you're also less likely to have a problem with your parathyroid glands after surgery. And that's probably the worst complication that you can have from thyroid surgery, is to hurt your parathyroid glands. Parathyroids, for those of you who don't know, parathyroid glands live very close to your thyroid. They don't do any of the same things that your thyroid does. Your thyroid controls metabolism, which is why people with Hashimoto's and Graves' disease are so affected, whereas your parathyroids control calcium. And so if you have osteoporosis or kidney stones, you probably should be checking your parathyroid hormone levels, because if you have those conditions, it can be problematic, and your parathyroid can be to blame. But if you don't have a parathyroid problem, we want to leave your parathyroid glands alone when we do surgery. And the biggest complication that can happen is if we accidentally hurt your parathyroid glands, then you can end up on lifelong calcium supplementation. And that really affects your quality of life. So the things that you can do to kind of prevent that complication include doing less surgery and finding a surgeon who does more thyroid surgery. Because the more thyroid surgery that your surgeon does, the better off your outcome is going to be. You're less likely to have complication. And in fact, if you check out our website right now, I put up 14 questions that you can ask, like when you're trying to find somebody to treat your thyroid problem. And so there's lots of people are looking for, how do I find a good person to treat my thyroid problem? The American Thyroid Association has a great resource. If you're a member of the American Thyroid Association and you live in North America, that's a pretty good sign that you prioritize thyroid care in your practice. Outside of North America, a lot of people are also members, but you want to find a doctor who's associated with one of these big thyroid organizations, because that just shows you that they really care about thyroid, and they dedicate time to staying on the cutting edge of thyroid care. So pay attention to that. But in addition to that, I put up a list of another 13 questions that you can ask as you're trying to find a doctor for you to help you take care of your thyroid. It's actually pretty hard, because endocrinologists who manage thyroid problems right now are super backed up. Like, there is a huge backlog to be able to find an endocrinologist, especially if you're looking for a good one. I am an endocrine surgeon, so I do thyroid surgery. And in my practice, we do manage thyroid problems like Hashimoto's thyroiditis as well. But usually you would come to me if you need surgery, or you want to shrink your thyroid nodule, or your thyroid is bothering you for some other reason. Like, sometimes people will feel pressure. So let's pause for a second. That's actually a good segue. How do you know if you have a thyroid nodule? You know that you have a thyroid nodule if you can see something visible in the bottom of your neck, if you can feel something moving around there. Sometimes people will have pressure when they swallow, and they'll feel like a marble rolling back and forth. Other times, patients will notice that if they lay on one side or the other side, it gets more pressure on their neck. And some patients, I even had a patient in the last couple of days who says that she gets dizzy when she lies on one side, because it probably is putting pressure on some of the big blood vessels inside of her neck. You could also know that you have a thyroid nodule. Again, if your thyroid function is off, that could be one reason to know that you have a thyroid function. And sometimes in bad cases, if your voice changes. But thyroid nodules are super common, and they don't always have obvious symptoms. Okay, I've been talking for a while. Let me just kind of go through really quick and see what sort of good questions. Jade Monique Music, Dad had throat cancer and years later he had difficulty swallowing. Yeah, throat cancer will definitely cause problems swallowing, and that is different than from thyroid cancer, for sure. Red, mine was so bad and GP kept telling me it was anxiety. Finally got the diagnosis. Thank goodness you did, because an overactive thyroid, which is the most common cause of anxiety, if it's a thyroid cause, it can not just mess with your anxiety in your head, but it can also mess with your heart. Shanahan, full of swollen lymph nodes all around. Okay, get those checked out. After radioactive iodine, been having problems with salivary glands. Yeah, that's common. Yet another reason that if you ask me the best treatment for a thyroid problem, not radioactive iodine. Sometimes you need it for bad thyroid cancer. I say that all thyroid cancer is bad, but the really aggressive forms of thyroid cancer probably should have radioactive iodine. But people with in-between thyroid cancer or the less aggressive thyroid cancer, usually they don't need radioactive iodine because it'll mess up a whole bunch of other things. Patient with a brain tumor, sometimes it could be thyroid related, but it's usually not. Shanahan, yes, reach out to my office. Removing your thyroid can cause heart issues, Channy 0524, heart issues, breathing issues, and swallowing issues. Well, it can, that's true. Also, if you have all of those issues, it could be caused by your thyroid, and thyroid surgery could fix all of those issues. And so it's kind of specific for every single patient. You don't want to take your thyroid out unless you need to, but if you need to, thyroid surgery can be life-saving or life-improving. How do you feel about chiropractors wearing, Gio, love that question. Chiropractors wearing surgeon caps, I don't know what the right word to say is, but serious pet peeve of mine. Like this, I'm in the operating room because I was operating on thyroid problems. Actually, I was doing a parathyroid surgery today, so it wasn't even a thyroid surgery. But yeah, so that's why I wear my scrub cap, and I paid for it, blood, sweat, and tears because I'm a surgeon. So I should introduce myself. I'm John Russell. I'm a thyroid surgeon and parathyroid surgery, obviously. I'm at the Russell Center for Endocrine Health. Before that, I was at Johns Hopkins, which is of Grey's Anatomy fame. I was there for 10 years, and I led their thyroid surgery program, their thyroid tumor conference. Before that, I was at the Cleveland Clinic, and now I started my own practice and just outside of Washington, D.C. So that's who I am. Okay, let's keep going through questions. Body pains every day, a lot of blood work and scans not showing up. Discover TNT 100, good luck. Website is russell-center.com, spelled in North America, RUSSELL-center, CENTER.com. Check us out and reach out. How big is the risk of vocal cords being affected during thyroid cancer surgery? Maggie Pentek, it depends on how big your cancer is. It depends on where it is. For me, if I do scarless thyroid surgery, so people always ask, why do I specifically talk about the scar so much? Because in all of the scarless surgery that I have done personally, I have never caused a patient to lose their voice permanently with thyroid surgery. And so that's one of the reasons. It's not just that scarless surgery is nice cosmetically, but it also can be a very safe way to do your surgery. And so the risk of vocal cord injury, if you see a high volume, very experienced thyroid cancer surgeon, is very, very low. Always things can happen. It's why we talk about it. But if you see somebody who does lots of it, the risk of that should be close to zero. Do you appreciate scrub techs truly? Zaylee Marie, I'm checking to see if you are one of my scrub techs. Yes, scrub techs are the difference. In fact, when I started residency at the Cleveland Clinic, one of the scrub techs pulled me aside and said, I will make or break you in the next 5 years. And she was spot on. Like, if you have a good scrub tech, they will keep you out of trouble so many times. You have to treat those people well. 40 milligrams of methimazole is a ton of methimazole. Graves and hyperthyroidism, Akimi, make sure and get your thyroid under control. If it's really hard to control and your levels are that high that you need 40 milligrams, sometimes it's worth talking about surgery as a potential solution. Shanahan, thanks. Glad you're learning something. Lisa Coughlin, nodules, years since I had an ultrasound. You get pain in your neck. Do an ultrasound. If you got pain and it's been a long time and you know you have thyroid nodules, talk to your doctor about getting an ultrasound or come see us. GMDA, I have hypothyroidism, 2 nodules. Surprised that my blood work results are normal this week. Congrats, that's a good thing. MEN1, okay, there are some conditions that are associated with either thyroid or parathyroid problems and maybe even cancer. MEN conditions are some of those. So make sure, Lois, that you're following up well and closely with your doc. Brujaviera, doctor, I have thyroid's 3-4 cyst, negative biopsy, can it become cancerous? Yes, any nodule could always become cancer, even if it's benign, but that is very rare. And so we don't really want to make people too stressed out. If you have a benign biopsy, it's a very accurate biopsy. As long as your ultrasound is not suspicious, you should trust your biopsy. If your ultrasound is suspicious, you should probably keep doing ultrasounds, but talk to your doctor because there's lots of different things that go into that decision. Calcium deposits in your parathyroid glands, KGV 1611, King James Version, what? Calcium deposits in your parathyroid glands. Usually you would have calcium deposits in the rest of your body because of your parathyroid glands. That's a little bit confusing to me, so make sure and talk to your doc about that one. Best foods to eat after thyroid cancer. Rach, we have a nutritionist, so you should reach out. A thyroid cancer dietitian is on Instagram and TikTok, and she is fantastic, so reach out to us. We can set you up. KGV 11, osteoporosis, yeah, it'll mess you up. Ever witnessed a heart attack during surgery? Caleb McClung, I don't think I have seen a heart attack specifically during surgery. We usually are very careful about the patients that we'll take back to surgery. We want to make sure that you're optimized because thyroid cancer, we have time to make sure that you're healthy before we go into surgery. So we try and be really careful. Potentially like a thyroid storm is something that we always worry about, but we can usually check your labs and do a lot of checkup to make sure that you're optimized and as good as and safe as you can be before you go into surgery. 2 removed, Lottie Judy 57, congrats. Rosie the Corgi, is it enough to just do ultrasound of the thyroid to diagnose it as cancer? Lymph is swollen but no nodules. It all starts with ultrasound. Not necessarily that that's good enough, but that's usually where we start. Tongue cancer and thyroid cancer, Jade Monique, huge difference. Tongue cancer has a much worse prognosis, thyroid cancer, much better prognosis. Let's go down to more recent questions. Jonathan, beating thyroid cancer, good job. What's the chance of PTC turning anaplastic for ages below 40? If you don't do any treatment on it, then your risk is higher, but it's still pretty low. And the reason for that is that all cancers are inherently unstable in their DNA, and the more mutations they get, the more likely they are to become something really, really, really bad like anaplastic thyroid cancer. Shanahan, I swear you're having thyroid storm, went to hospital instead of your thyroid shut down. Get that taken care of. Brittany Martin, what are the best diets to follow with hypothyroidism? People talk about the gluten-free, people talk about the Mediterranean diet. For me, the best diet is one that you can follow and keeps you away from ultra-processed foods. Because I think ultra-processed foods probably contribute a lot to the inflammation. We also know that obesity causes both thyroid nodules and also thyroid cancer. And so if you can stay on a diet that avoids ultra-processed foods, keeps your inflammation down, it probably doesn't have to be gluten-free, even though some people have success with a gluten-free diet. The research says that a Mediterranean diet can be just as helpful at reducing your antibodies. So call me Andrea. Mom had thyroid cancer, thyroid removed, now she's on med, but has so much health issues. Get that checked out, because normally after thyroid surgery, we tell our patients that you should be just as well off after surgery, if not better. And so if you're not back there or she's not back there, talk to your doctor and try and figure out why. Symptoms like hypothyroid but negative blood check. There's a lot of patients who have what we call a prodrome, meaning that before your labs are abnormal, you will actually feel abnormal. And in those situations, it's usually you as the patient, it's your time when you can intervene and you can alter your diet, you can alter your exercise, you can alter your stress, you can try and improve all of those things. And that's the space before you need a doctor where you kind of are the person that's in charge of optimizing your thyroid health. Again, like supplements tend to be not super effective with that. Selenium for some people can be beneficial. Iodine usually is not needed if you're in North America, but kind of you just want to make sure that you're following up closely and doing what you can to keep your inflammation down. Mama Izzy, how do you know if you're having thyroid storm? Palpitations, your heart rate's going too fast, you're really sweaty, you're really hot, you can't sleep at night, you're losing weight quickly, those things are bad. Molly B, grandson sees his endo on Friday, hypothyroidism on 100 micrograms, he's 15. Yeah, when young people have low thyroid, it can be even more problematic, and you're gonna wanna check and talk about thyroid nodules certainly on a young patient like that. Kaita Party, levothyroxine on 200 milligrams, but still no improvement. Should you request an ultrasound? Or you could also try some T3. For some patients who are not responding well to thyroid hormone, like T4, sometimes those patients can do T3 and that can help. Call me Andrea, we talked about your mom's thyroid cancer, sorry about that. Casey Odell, papillary carcinoma diagnosed in surgery, full thyroidectomy, doing well. Awesome, congratulations, good for you. Taller rather than wide nodule and 22 weeks pregnant. Megan Cherie, usually we don't treat cancer thyroid cancer during pregnancy, because for almost always, thanks for that. Usually, the reason that we don't necessarily do that is because the risk of surgery to the fetus is greater than the risk of cancer to the mom and the fetus, usually. But you need to talk to your doctor about that one, because that's not always the case, and you want to be really careful. What is Nathan, what is the cause of nodules? It is usually bad luck or genetic. So it's probably genetic number 1, bad luck number 2, diet, sleep, exercise, exposure number 3. And so most people, if you check around, like, you're much more likely to have thyroid nodules if they're in your family than you are if they're in your friend group, meaning that what your friends are eating and what you are eating is not as likely to cause your thyroid nodule. What issue, Riley Marmion, you can prevent thyroid issues by staying at a healthy weight, avoiding ultra-processed foods, and just being healthy overall is kind of the biggest things that you can do. Okay, I think we're just about caught up, and I'm just about at my 30 minutes, which means I got to get back to the operating room and get stuff done. Thank you, Berlin. That was very nice of you. RFA for last question for a T4 nodule. RFA can be good, but it doesn't really depend on what it looks like on ultrasound as much as what it depends on your biopsy. So you need to have 2 benign biopsies before you can do RFA, or you need to have one biopsy that shows that it's cancer, but it's small. So talk to your doctor. If we can help, again, I'm just outside of Washington, D.C. Super happy to help all of you. Follow, share, like, whatever, because almost everybody listening to this either has a thyroid nodule or knows somebody who has a thyroid nodule. So good luck, everybody, and God bless. Happy holidays.
Nung chinis ko nga po siya, akala ko hindi niya ako